Plastic surgery, unpopular opinion. I recommend wearing a bra to bed. Don't hate me. First, getting this out of the way. Yes, it's easy for me, a man who does not wear bras, to say this, but I think there's some rationale, and so let me explain. So for my recommendation, for my implant patients, I recommend wearing a bra to bed, and specifically one that has good side support, which unfortunately tend to be bras that are more like underwire-like bras, and those are even less comfortable to sleep in. So let's talk about first who this pertains to, and then again, a little more on the why. First, this recommendation is particularly true for my patients who have larger implants, i.e. heavier implants, have smooth implants, which all my patients do, and not textured implants, implants that are placed under the muscle, and patients who have a rather sloped rib cage, like pectus carinatum, and you can Google that if you'd like, but more angle or steeply angled ribs. So why does it matter? Well, implants are mass, and because they have mass, gravity will pull on that weight and it will move over time. Now, having some migration of the breast tissue and implant off of the chest wall over time is a normal process. I think it's a process that we can try and slow down, at least trying to take some of gravity's effect out of the equation. And with implants, it's more important because as an implant starts to shift down the slope of the rib cage, the ribs become progressively more steep, right? More angled, because everyone's ribs eventually turn and go to their spinal cord. So as the implant starts to settle to the side, the center mass of the implant is sitting on a steeper incline over time. And so that process may accelerate. So if we can try and delay that process, keeping the implant on the front of the chest as long as we can, we may be able to do that. And that's why it's so important to have good side support, something that's keeping that implant up on the flatter part of the slope for as long as we can. Now, how do we check to see if your bra is the right kind of bra for your implants at night? Well, actually, this is pretty easy to check. So first, you need a mirror, and you'll have your mirror. You'll not be wearing anything, seated, okay? And then lie down. And you'll see that the breasts and the implants shift a little bit to the sides. Again, that can be normal. Then you're gonna try on whatever bra you're trying. Do the same steps with the mirror. And when you lie back, you should not see the implants shift out to the side to the same degree as if you weren't wearing a bra. And that's how you'll know if you have adequate side support at night. Now, typically when we're thinking about side support, we're thinking of bras that have a physical wire that goes from the bottom and up the side. That will work, but typically that bothers patients at night. It's not comfortable. There are other types of bras that have a silastic bendable rod, maybe a little more comfortable, and newer bras that have reinforced fabric along the bottom and then up the side. Those may be the most comfortable, but the point is to check and make sure that it's actually being effective for our purposes. There are, of course, many factors that control implant position and implant migration over time, and some of those we can try and control or fight, like gravity, and some we can't, like inevitable biological aging. Another critical one that we're not addressing is how much native scar tissue or capsule that you'll form around your implants, and that really may be the most determinative factor of keeping your implants in position. Obviously, many things go into it, but we're trying to affect the things that we can. So that's one of my unpopular plastic surgery opinions. If you have a comment and it's a constructive comment, please leave it below. If you have other questions for me, reach out and we'll be happy to answer them.